The patient looked at me and said, "Doctor, I thought she was a doctor. I have been telling all my family members that I have this great doctor." And it broke my heart because I have heard that story over and over. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. I have an 83-year-old patient come to see me as a new patient, came in with his daughter. And as always, I asked, "Who was your previous doctor?" And he told me the name of somebody. And I said, "Why did you leave them?" He said, "Well, I've been calling the office for 4 months and I cannot get anybody. She just skipped town. The phones are not working. No one is returning calls and I don't know where to get my records." And so in trying to find out this person so I could help in getting records of the patient, I discovered that the person is a nurse practitioner. So I asked him for the person's business card. The daughter gave it to me and I looked her up, and indeed, she's a DNP, which is a doctor of nursing practice. And so I told the patient, "This is the person, right? A nurse practitioner." And he was like, No, she's a doctor." I said, "Well, a doctor of nursing practice. This is a picture." He said, "Yeah, that's a doctor." I said, "Well, I don't know, but just for clarity's sake, this was a nurse practitioner." And he looked at me and said, "She's not a doctor?" I said, "No, she's not a doctor. Not in the conventional sense of the word, at least." I said, "Well, I've been telling everybody that my doctor, she's not a doctor." And that is where I realized that I need to bring some clarity to this situation once and for all, because I have had this experience several times with patients, right? This is the situation right now. Let's get into the science. Let's get into the weeds of things. The purpose of this episode is to provide clarity to patients. I like to use an analogy, okay? When you're going to fly on a plane, you walk in and you're greeted by the flight attendants. You can tell they're flight attendants. You look a little bit to your left, you can see the captain and the co-pilot sitting there. And you get into the plane, you can look through the window, you see the baggage carriers. All these people are important in you getting on that plane, flying to your destination safely. But guess what? You know who they are. You know their various roles. When your bag doesn't arrive at your destination, you don't blame the captain, right? When the plane doesn't land safely, you don't blame the flight attendants. What has this got to do with medicine? Because medicine was built as a pyramid system, similar to the way a plane operates. At the top of the pyramid, you have the medical doctors. At the lower level, you have the flight attendants, in this case, nurse practitioners, physician assistants. And then as you go further, you have medical assistants, you have phlebotomists. All of these are essential parts of the puzzle, but they must be clear to the patient. Why is this important? Now let's go back to my patient. The patient is 83 years old, has high blood pressure, diabetes, had a heart attack, and also has prostate cancer he battled for many years, but eventually vanquished and was in remission for several years. He is a complex patient. It is important for this patient to know who is in charge of his care, right? So let's get into the science and actually see why this matters. This matters first and foremost because the training is different. A medical doctor, an MD or a DO, doctor of osteopathy, who follows the allopathic path, what we medical doctors or MDs follow, require at least 8 years of training and at least 15,000 hours of supervised care. Now compare that to mid-level practitioners, nurse practitioners especially, and PAs. But nurse practitioners on average would spend probably 5 years of training, that is 3 years for a bachelor's degree in nursing and 2 years for a nurse practitioner degree, but 500 hours of supervised clinical training. Now, when it comes to that supervised clinical training, it is wild. It runs the gamut from good supervised clinical training to terrible supervised clinical training. And I know for a fact, because I have hosted nurse practitioners in their training programs who rotate through this clinic. And I know that many have told me horror experiences in certain places. Some places where they pay $1,000 for supervision and then nobody ever supervises, nobody ever tests their clinical knowledge, no one puts them through the grinder that you have to go through in medicine to be able to be clinically accurate and clinically ready to take care of patients. Then you have others who come from great training programs. Don't get me wrong. And so when you compare this training, there are entirely two different professions, right? And then we have the problem that surveys have shown that only 9% of patients actually properly understand the difference between an MD, a DNP, an NP, and a PA. They're not too sure. And another survey done in California showed that patients actually want the title of doctor to be reserved to MDs or DOs, and anything that has ologist at the end to be reserved to MDs or DOs. You can check it yourself online. Why does that matter? This is not a flex. This is not an ego trip. This is not bashing nurse practitioners. I do hire nurse practitioners. If you've been to this practice, we have them, especially in this mental health team. They're excellent practitioners. But they work in an integrated system where clinical supervision does exist and where the medical doctor is ultimately responsible for your care. That is how good healthcare systems are supposed to operate. Now, let me tell you who's to blame. It's not the patient. It's not that the patient makes uninformed decisions or patients are not interested. The problem is that the healthcare system as a whole profits from patient confusion, right? You have many practices or many hospital systems where patients go to the emergency room and never see the doctor. Other places where patients have an appointment and they are not even told that they are seeing a mid-level practitioner. Maybe the care will not be different, but it's the patient's right to know. If you got on a plane and the plane took you to your destination, you went from New York and landed in Washington, D.C., everything went well, but you found out that the pilot was sitting in the back sleeping and the flight attendant flew the plane. How would you feel about that? Now, you might have gotten to your destination, but I bet you next time you get on that flight, that company's airline, you will be checking who's flying the plane. So let's not kid ourselves. This debate about doctors and nurse practitioners and all of that is important, not for the reasons why people are fighting. It's not because doctors want to show that they know more than nurse practitioners, all of that. It's important because patients have the right to know who's flying the plane. That is the crux of the matter. And it's important for a second reason. Complex care requires complex abilities. It requires expertise, right? If I'm a primary care doctor, a patient has a heart attack, guess what? All of a sudden, we bring a cardiologist into the picture. I cannot say, well, I'm a primary care doctor, I'm a doctor, I was trained, I can handle it all. No, you bring the expert into the picture. So consequently, nurse practitioners, PAs, they are great with patients who are young, do not have multiple medical problems, and are being seen for simple problems. When the patient becomes complex, their care has to be taken care of by the person who is highly trained, a doctor, or a specialist. That is how it's supposed to work. So another reason why this is important is because of the proliferation of titles, right? You have the MD, you have a DO, you've got a DNP, you have a PA. Now you also have DPT, Doctors of Physical Therapy, and then you have a chiropractor, you've got an optometrist. There are so many doctors that patients become confused. That is why in this practice, we reserve the title of doctor to MDs and DOs. Everybody else goes by their title, DNP, PNP, DPT, and the like. But the title of doctor in this practice is reserved for primary care physicians and the specialists because we want you to be aware of who is flying the plane of your health care. It is not about fighting unnecessary battles with nurse practitioners, PAs, and doctors. It is about introducing clarity to patients. And so I want to be clear about something. PAs and nurse practitioners are invaluable contributors to the healthcare system, but your care must be led by a doctor. That is a non-negotiable. So next time you go to a doctor, in this clinic, in another clinic, or anywhere else, even in a hospital, always ask, are you a doctor or are you a nurse practitioner? Are you a doctor or are you a physician assistant? Not because they are less valuable, but because you deserve clarity. You need to know who is flying the plane of your health care. And on this note, I will leave you today. I'll see you next episode because the fight for your health doesn't stop here. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.